Welcome everyone. This is Dr. Serrano, aka the neurologist. I'm shooting this video for all of you who are out there wondering what it's like to be a PGY1. Uh, and this is going to be like a retrospective analysis because I'm currently a PGY2 training in Washington, D.C. Uh, PGY2 is actually for neurology training, it tends to be a little harder than PGY1, but I think I was able to do a pretty good job as a PGY1. And I'm going to share what I think are my 5 top things that you need to know as a reflection about my past as a PGY1, I guess. So, 5 things you need to know um, for incoming residents who are going to be PGY1s. So number one, I will think it's manage your expectations. I guess that one of the biggest reasons why people feel imposter syndrome while they are PGY1s is because they have unrealistic expectations about who they are at that time. So number one, you need to understand that you are in training for a reason. And the reason is to become better at that special field within medicine. Okay? So it's impossible and it's unrealistic to think that you're going to be or you're going to behave like a well-trained resident or a well-trained kind of early attending. And that sometimes, believe it or not, those are the expectations that some people kind of have in their minds, that they're gonna go there and they're gonna crush everything, and they're just gonna be uh, so independent and so great, like if they were attendings. And I guess that when you don't realize it before starting. You just want to do good, okay? You just want to do well. You just want to excel, and that usually leads to um, imposter syndrome, because once you start training, you start seeing that it's impossible for you to know everything. It's impossible for you to know what to do in a specific circumstances. That's what training is about. So, by you managing your expectations and telling you that it's okay that you're going to make mistakes, it's okay that you might miss things. It's okay because you are in training. You are about to become someone who is about to learn. So, number one is manage those expectations. Number two, and that's, I think, more important than anything else, it's your mindset. I mean, you're there to train. There are going to be great days, there are going to be bad days. But if you have the good mindset, you're going to be able to tackle those challenges without a problem. Oftentimes, I'm seeing on Reddit and other forums that people go with this impression of, like, I don't know what's going to happen, it's going to be horrible, I'm not going to do well, which is kind of the opposite of the expectations, or maybe just like a sad realization that you already set those high expectations. Probably you feel like you're not going to meet them. So that kind of leads you to feel like you're going to mess it up every time. So, it's a vicious cycle, that just keep repeating itself. So have a good mindset, You're there to train. It's going to be 3 or 4 years of your life. Usually the first and second. It's going to be rough, but it will pass. Time will pass. But if your mindset is correct, people will be willing to teach you. People will be willing to help you. And honestly, your mind is going to be willing to learn. But if you go with a wrong mindset, you're going to be just shot. You will not want to learn. You will not want to do things. And that's a disservice, and that's going to impact your residency training. That's number two. Number three, show up on time. And then, by all means, I'm not that type of guy who are just kind of chasing people like, oh, we have to be 7. I usually have like sometimes 5, sometimes 10, sometimes maybe 15 minutes late. Because, when you're doing your pre-round, things happen, Patients might be extra chatty. And it's also an art to learn how to just get away the correct information. And for people like me who just, it feels horrible. I feel so bad to kind of cutting people off. But sometimes you need to learn how to do that but at the same time addressing every single concern that a patient might have. So it's an art, okay, that you will develop. So you don't want to completely shut them off, but you also don't want to have conversations that lingers and that are not providing anything good for you because you have to see another amount of patients. So that can lead you to kind of be late for 5, 10 minutes, 15 minutes. That's fine. Toxic people will say it's not, but it is fine. But but showing up, it's important. You will have a disaster coverage, like basically a disaster pool where someone gets sick and then someone else can fill in the blanks. Don't be the type of person who disaster other people just because you don't want to go to work, or just because you have a wedding or you have an event and you don't want to miss it, so you're just going to pretend that you're sick, or you're just going to find whatever ridiculous excuse to miss work. That is going to hurt you because you're going to work with that people like 4 years. And believe it or not, setting up a reputation of a person who avoids work, it's very detrimental for your training because nobody can rely on you, nobody can trust you, and that just kind of sends like a ripple effect. And then attendings know about it, and then you're just kind of having like an uphill battle trying to reverse whatever you did at first because you're going to be totally lazy, to be honest with you. So show up. I'm not even saying show up an extra time if you can't find, but show up regularly every day as you can, as you have to, as your schedule dictates it. Okay? Number 4, it's like maximize your wellness. And by this I mean work when you have to work. Have fun when you have to have fun. And I'm not saying that you cannot mix, that you cannot be happy, like, because I am the most like extrovert guy in the world. I mean, I talk to literally everyone from the housekeeping services to whatever person it is, because I like to treat people equally everywhere and be nice. So I am that type of guy who's going to be saying, hey, hi, how are you? How's it going? What I mean is, try not to take work at your house. As soon as you reach home, that should be the moment when you have to relax and kind of detach from everything. Otherwise, you're going to be burned out, you know? And it's funny because I just recently almost experienced it. I always have that rule, I'm not gonna go to my house to finish work. So I usually just stay in the hospital, but there are some days that you get like crazy slammed and you leave like pretty late, So it has happened to me, but I kept my promise not to bring work to my house. So that's why when I'm here, I'm able to kind of just relax because it's much needed. You need that time. You need time to go out if you don't have to work the next day. Don't be fooled, And then that leads me to my number 5, sleep. Be careful with that. When you don't sleep, when you just kind of are just kind of sleeping for 4 hours, and you think that you're gonna do okay, and that's the way it is. It's not the way it is. I see like a big time correlation with burnout, with depression. Believe it or not, we kind of makes sense. But depression, your well-being by itself is just heavily disrupted by lack of sleep. So it can be because of work. It can be because of revenge sleep. If you want to just Google that up, because it actually is a term and it exists. And revenge sleep is basically, I just got from work at 8 p.m. and I just refuse to go to bed because I want to catch up on things. I want to catch up on life. I want to see a TV show. I want to kind of check social media, which is something that I don't really do a lot anymore. So that also impairs your sleep, or, oh, you know what, they're going out and I have FOMO, and I want to just kind of share with my peers. Don't do that. There will be time for that, okay? So don't impact your sleep. And I promise you that you're regular and conscious with your sleeping habits, you're going to perform better. If you don't sleep, or you have days in a row where you're not sleeping enough, you're not going to perform, You're not going to perform well. You're going to be trying your hardest, you're going to be working hard, but you're not going to be able to achieve the amount of performance that you need because your body is crazy tired and your mind is crazy tired. And that's ultimately the problem with burnout. You know when your muscles are fatigued. You know when your body is tired. But the brain, it's hard because it's something that you're not used to. You can't really measure how much fatigue is until you feel foggy, and then you drink coffee, and then you kind of cheat yourself. And you keep doing all these things, and you keep taking Red Bulls and taking Monster, which is something that I don't do and I don't recommend. But you don't really know how to measure burnout in your brain as a structure, because it's different than muscles. So maximize your sleep, and I promise you that you will start performing better, because at the end of the day, you need to know that residency is a marathon. It's not a sprint. It's not something that you do in one day. It's something that you do in the course of many, many, many months, and you need to build up stamina, but you also need to rest. So if you do all these things, you're gonna do great. I think I did great. I even got an award for it. So I think I did very good in my intern year, and now my PGY2, I'm just trying to do the same. But I think if you follow those kind of simple 5 steps, or those kind of have the back in your mind, those 5 things that I just talked to you about, your residency experience is going to be good. It's going to be great, and you're going to love it. So have a good mindset, show up, try to show up on time, be gentle, be kind, be nice, okay? Have a positive attitude, and then have a good sleep, and honestly take care of yourself. And I promise you that you are going to do great. You'll find great people, you'll find bad people, you'll find great residents, you'll find not so great residents and attendings that you will work with. So don't take things personal, okay? And then find ways to decompress and detach, and go out when you have to go out, and have fun when you have to have fun, because you deserve this. So for those out there who are going to start residency, congratulations. For those who want to start residency, work hard, and you will make your dreams come true. And for the rest, you have people like Match Your Resident who kind of try to do this with us so we can help you out. And they provide really great services. And there's also us as residents who want to see you succeed. There's me, there's a couple of amazing people who I'm friends with who are also doing these videos. And then rely on them and rely on their feedback. And if you have a question, you can always ask. Okay, I'll always try to reply in a timely fashion, but remember, I'm in residency, and we're here, we're around. Okay, so keep going hard, keep going strong, and just if you need more information, you can follow me back at the neurologist, and we will see you in the next video. And keep going strong. I'll see you around.